Good morning, I'm Callum Rodia here in the Sudbury.com newsroom, and in just a moment we will take you live to Health Sciences North for the grand opening of the Ronald McDonald House Charities Toronto Family Room, which, according to a media advisory, will offer a home away from home for families with children in the Neo-Kids Pediatrics and Neonatal Intensive Care units. Sudbury.com is on the scene to bring you full coverage of the grand opening ceremony, followed by a tour of the new room. Stay with us as we take you there live now.
Good morning, bonjour. I'm Denis Roy. I'm the CEO of Health Sciences North. It is my pleasure to welcome you to Health Sciences North. I would like to thank Mayor Brian Bigger for being here today, but I also would like to thank you for declaring November Neo Kids Month. Very important. And thank you all for being here. I especially want to welcome our out-of-town guests who had to drive through Barrie and Parison yesterday. For those of you who have not flown in, and are from the Ronald McDonald House Charities, who have come from Toronto. We are here to celebrate and honor the families of children who come to HSN Neo Kids program for care. And they come from across the northeastern Ontario. Now, as adults, we know that being hospitalized can be quite intimidating. It can be overwhelming. It certainly is impersonal, and it's not set up for family members. Imaginez maintenant cette hospitalisation de perspective d'un enfant. On peut tous imaginer la crainte d'un enfant face à un séjour à l'hôpital. Un milieu qui ne leur est pas familier, des visages inconnus, et imaginez les parents de ces enfants qui veulent rester ici, mais qui sont inquiets et qui sont épuisés. Imagine what it feels like for a child in hospitals to watch their family members leave the unit to get some much-needed rest and perhaps something to eat. Now, imagine being able to offer these worried and tired patients a place where they can just replenish down the hall. Allow me to repeat what I've said many, many times before, and I'm sure Dr. Murray will use that sentence more often than once in the future. Children are not small adults, and the healthcare system cannot treat them in that way. The places where they receive their care cannot treat them that way. And when it comes to healthcare, children have special needs and sensitivities. The environment in which they receive care must reflect that. La nouvelle d'aujourd'hui reflète notre engagement et celui de nos partenaires à créer un environnement chaleureux et approprié pour nos jeunes patients et surtout leurs familles. Today's announcement is a huge step forward in these philosophies of care. It is made possible through the incredible cooperation between partners who share this vision. Those partners are HSN and Ronald McDonald House Charities of Toronto. It is my great pleasure to welcome Sally Ginter, the CEO of Ronald McDonald House Charity of Toronto, to make this morning's announcement. Welcome, Ms. Ginter.
Merci and thank you, Dr. Roy. Since 1981, Ronald McDonald House Charities Toronto has been fulfilling its mission to keep families together while their child is being treated for a life-threatening illness. For those of us who have never had the experience of having a seriously ill child, it is hard to imagine the many difficulties these families face. Distance hurts, and research shows that a family's ability to stay together while their child is sick significantly enhances their physical and psychological well-being and enables them to be more involved in clinical decision-making and care. Their child needs them close by. As many of you know, RMHC Toronto operates a house in downtown Toronto for 81 out-of-town families whose children are undergoing life-saving treatment. In fact, 164 families from northeastern Ontario stayed at our house last year alone. It's nice to see some of those faces in the audience today. Fewer people know about our family rooms within hospitals. In our family rooms, families with sick children find a soothing place where they can retreat from the beeps and buzzers of their child's room while maintaining their presence just a few steps away. It's a non-medical environment to find some comfort and relaxation. We opened our first in-hospital family room at Credit Valley Hospital in Mississauga exactly 5 years ago on this date. And today, I am delighted to formally announce the opening of the Ronald McDonald House Charities Toronto Family Room at Health Sciences North. The family room at HSN is our 7th in-hospital family room, but it is the first one to be opened outside of the Greater Toronto Area. RMHC Toronto is delighted to be expanding the support it provides to families from northeastern Ontario. With the opening of this family room and with our newest hospital partner, Health Sciences North, RMHC Toronto can now support families whose child is hospitalized in Sudbury. The family room will keep families close to their children when in the Neo-Kids pediatrics and neonatal intensive care units. The family room, as you will soon see for yourself, is a beautiful space with a beautiful view. It has a relaxing fireplace lounge with TVs and a kitchenette stocked with beverages and snacks, open 12 hours a day. Families also have access to 2 restrooms and respite areas around the clock with a total of 6 recliners so they can nap and sleep. In the family room, family members can grab a coffee, eat a meal, watch TV, sleep undisturbed, or find a listening ear in one of our volunteers or staff. Whatever they want to do, the family room is their home. I want to thank everyone who works with us, who shares our vision about the importance of keeping families close. Family rooms are a significant investment for RMHC Toronto, but they are mission critical for the organization because we know family rooms make an impact. And we know there is an immense need for this type of support. I offer a special acknowledgement to our volunteers. We couldn't operate the family rooms without them. More than 60 wonderful people from the Sudbury area have so far stepped forward to volunteer their time to support our families here. And these volunteers have been busy so far. Since the family room first started, quietly, welcoming families in December, we have so far had more than 1,500 visits by close to 90 families. And there will be thousands more in the years to come. Many of our volunteers are here today, holding a red rose as a sign of our gratitude to them. We value and appreciate all that you do, and you are the heart of the family room. Another volunteer joining us today is RMHC Toronto Board Director David Ogilvie. Thank you, David, for your support and leadership. I want to thank our partners at Health Sciences North for working with us so closely to make this family room a reality. Dr. Roy and Dr. Sean Murray, Kim Warren, Pat Tessier, Debbie Lahi, Chris Guillot, and Françoise Rossel, and all the staff, both in clinical areas and support areas, for sharing our belief in the importance of family-centered care. I want to thank our generous donors who provide the funding to open and operate the family room. Ronald McDonald House Charities Canada, which provided the capital grant to support the construction of the family room. McDonald's Restaurants of Canada, our founding and forever partner. Through the commitment of owner-operators across Ontario, we continue to receive significant funding from McDonald's to operate our house and our family rooms. This year, in fact, contributions from the McDonald's family will represent 1/3 of our overall funding. They are critical, important contributors to our mission. Locally, Brian and Lee Gaynor, and in North Bay, Brad and Joanne Haynes, are among the generous owner-operators who believe in giving back to their community. We are grateful they are here today, and Brian will be offering some words shortly. Our remaining support comes from the community, from individual donors, from events, companies big and small, from people who share our commitment to keeping families healthy and keeping them together. We are so grateful to them all. Following the remarks by Brian Gaynor, Dr. Sean Murray, Medical Director of Pediatrics at Health Sciences North, will speak. Dr. Murray knows well the impact that having a sick child has on a family, and we are grateful that he has been a huge champion of the family room at this hospital. It is with pleasure and gratitude now that I invite Brian to speak.
Hi folks, my name is Brian Gaynor, Lee's husband, for those of you who didn't recognize me. I'm hoping to keep this short, and I'm hoping not to cry, because that's usually the two things that I'm not very good at. First of all, Mayor Bigger, thank you for being here, and it would be remiss of me not to mention to everyone that one of the reasons we're here today was Mary Ann Matichuk, who Lee and I spoke to a few years ago about the need for this room. At that point, we were fortunate enough for Mary Ann to set up a meeting with Dr. Roy and Sean Murray. These two doctors obviously knew what was needed. We spent some time in Mary Ann's office, and here we are today. I'd like to thank those people very much for making this possible. I'd like to thank Brad and Joanne for being here from North Bay. We provide 1/3 of the funding. I thought it would be more than that. I'm a little embarrassed by that. I think it should be more than that, and we'll do our darndest to make sure that happens. I would like to thank the volunteers. We all know how important this is. It's not us that we need to get the word out to. I have to do a better job making sure this community understands what we have here and how fortunate we are. I promise to do that on behalf of Ronald McDonald House and these volunteers. Thank you very much. Dr. Murray?
So thanks, Brian, for that introduction. And I want to say good morning. It's great to see lots of familiar faces and some new faces in the crowd. I'm glad that Brian touched upon the history behind all of this. It's not something that, as an initiative that was instantaneous. It's been going on for several years behind the scenes, and if not for the support of the community, support of the hospital here, and certainly the support of Ronald McDonald Charities, we wouldn't be in the position to have this beautiful room, which I've personally seen and have had the opportunity to speak to families about, and they do nothing but rave about the spot that we have here. So I'm hoping people can have an opportunity to see it later. It's a great space. As a pediatrician here at Health Sciences North, I see so many families come to Sudbury for treatment. They've traveled and are away from home and spend hours on the NEO Kids floor, sometimes days. The partnership with Ronald McDonald House Charities Toronto that led to this family room have a great impact on many families who receive care every day here at Health Sciences North. And it's important to emphasize it's the NIC or neonatal intensive care unit families, as well as the pediatric inpatient unit, that at the moment is benefiting the most from this particular room. Although we do have a lot of thoughts about expanding the scope of that to include children who are waiting in Emerge, and as well our ICU here in Sudbury as well at Health Sciences North. This family room allows parents to take a break, as Dr. Waugh mentioned, get some well-needed rest and unfortunately well-deserved rest due to the stress and strain of what's going on with their children. And also get some nourishment and heal themselves as much as possible so that they can help their own children and stay close by. I think, anyway, that Health Sciences North is leading the way in Northeastern Ontario as it relates to how it provides care for children, transforming it, hopefully, over time, even better than we have up to this point, looking at not only children and youth, but also taking care of the families. NeoKids has become a hub for a lot of subspecialized and specialized care that children do receive in Northeastern Ontario. And the goal over time is to improve that capacity. And so something like the NeoKids initiative, along with Ronald McDonald Charities, means this family room is going to be very, very important as we move into the future. As I've said in the past, NeoKids is a philosophy of care and an approach to care as much as bricks and mortar. Our goal is to ensure that northern children are treated in the north and they stay here. We want to ensure that they're treated in an environment that is tailored to children, and I will promise that once Dr. Roy has gone to mention that children aren't small adults lots, so you have my guarantee about that. Point taken and received. But it is very true. I'm making light of it, but it is a very important fact that we sometimes miss out in healthcare, that making sure children are actually treated in a way that is really patient and family-centered is very, very important. And of course, when you receive care close to home, you can expect better outcomes. And that's not just lip service. That actually, there's good, tangible medical evidence behind that fact, that when you have families close to this base of support, you have children in their community where that support is best served, children do better and are healthier and receive treatment and have outcomes from a health perspective that are better. So it's really important to me and certainly all the team at NeoKids that we can at least hold that philosophy up as much as possible. I really want to take this opportunity to thank the NeoKids staff, the nurses and the other support staff upstairs for really throwing their weight behind this. It's never easy to introduce something new in healthcare. Been through that a few times, so transformation is not without its challenges, but this has been accepted in droves, in part because of the volunteers, the way that things have been set up, and certainly the philosophy and the parents' reflection and feedback. So I want to support them. I thank them for their support, and hopefully maintain that really good work relationship so we can really have some benefit from the room as it relates to our children and our families. Last year, NeoKids saw 35,000 patient visits and consultations over the year, and also many inpatient admissions, both in neonatal intensive care and our pediatric units. And the long and short of it is that patient demand is growing. So unlike some areas of medicine, pediatrics, unfortunately, is a growth industry. And over time, I can only see that demand increasing. So partnerships like this are really fundamental to reducing the burden on patients and families that we're going to be seeing every day and into the future. To meet this growing demand for children's health care, NeoKids must grow as well. Thanks to Ronald McDonald House Charities Toronto for making this family room possible. It's helpful to know our families have a quiet place to retreat and regenerate while their loved ones are receiving what they unfortunately require here at Health Sciences North. I would like to introduce Susan St. George now. She's a family member and a previous patient of NeoKids, and has used the family room during her stay over the last few months, I believe in neonatal intensive care based upon the size. I know how much this space has likely meant for her and her family, staying close by when her son received care, but obviously I'll leave her to reflect on that now.
Good morning, everyone, and thank you, Dr. Murray, for the introduction. Please meet my son here, Benjamin. I'm here today because I want to thank Ronald McDonald House Charities Toronto for making this family room available to me and my family, and also to thank all the volunteers and the donations that made this room possible. This family room was a godsend for me and my family and came at the perfect time when we needed the most. I was expecting my first baby, this cute little boy here. Due to some early complications, I had an emergency C-section 6 weeks earlier than my original due date. Although my baby boy is healthy, he had to stay at NICU until he could grow bigger and feed on his own. When I was discharged, I was unable to take my baby with me because he was required with the extra care. It was something I found very difficult, not being able to take him home. I was unable to hold him, care for him whenever I wanted to, and the thought of not staying here with him was heartbreaking. The thought of having to travel to the hospital every morning and getting a break only when hanging around the hospital lobby would have been a challenge. But it was especially so since I was still not 100% up to recovery myself. This is where Ronald McDonald House Charities Toronto made a very big difference in our family. Thanks to the family room, I was able to visit the hospital every day, all day long. I had a place for peace and quiet. I had a place to unwind from the constant worry of a new mother. The family room was a place where my family and friends could also easily visit and support me. This is when my mom, Janet, over here. Knowing my son was just a few steps away, receiving the best of care, put my husband's and my own mind more at ease. The home away from home appeal of the family room and the truly welcoming volunteers who would chat with me helped keep us together. 10 days after Benjamin's birth, on Christmas Day, my husband and I received the best present ever. We got to take our Benjamin home. So Benjamin is now thriving, and so are we. So Ronald McDonald House Charities Toronto and its new family room at Health Science North is part of this reason. From the bottom of our hearts, thank you for keeping us and our families like us together.
Wow, I can get some tears going quite easily. Susan, thank you so much. What an inspiring story to tell us and to share with us. I am not the second Susan St. George. I am David Ogilvie. Sally did introduce me earlier, and I'm very honored to be a board member with Ronald McDonald House Charities in Toronto. I've been on the board for about 1.5 years now, and I am truly inspired every day by what this charity does. And to see what they've done here is absolute. I've already had a tour of the room, and I can't wait for all of you to see it. It really is spectacular. And you know, every day, or not every day, but when I do have the opportunity to go into the Ronald McDonald House in Toronto, I'm also inspired to see the families there and to see how well they're being taken care of in their most difficult time of need. Really makes me feel much better as a person, and it really, every time I leave that home, I feel like a new person because it's absolutely incredible. So we are now going to be wrapping up the formal part of today. I would like to ask that all of those who have spoken to please come up to the front. We're going to take a couple of photos, if we could please. Following this, the tours will start, so those will start in about 10 minutes. So I ask people to please enjoy the refreshments in the back before those tours do start. And thank you again all for being here. Thank you, Dr. Roy, and thank you, Sally, and all of your team for doing such a great job. Mayor, thank you for being here as well. Please enjoy the rest of your day. Thank you.
Hi, I'm Faye Roberts. I'm the manager for the family rooms for Ronald McDonald House Charities Toronto. And welcome to our family room here at Health Sciences North. Come on in. As you can see, the room is beautifully designed, very warm, and really our motto is keeping families close, and it can't get any closer than this. Steps away from your child outside of the hospital into an oasis, a warm space, beautiful furniture, very warm and welcoming. Come on in. So as you can see, we have a lovely kitchenette where families can put away a little bit of food, save a bit of money, and get something to eat, because oftentimes families forget to eat. We often prepare coffee, we have a bit of soup, and the basics to basically get someone through the day. We provide real crockery, dishes, and cutlery, nothing worse than plastic, but very warm and welcoming. a dishwasher so that families do feel that this is a part of home. Over in the family room itself, we have this beautiful furniture. It is designed specifically for cesarean mums in mind. It's easy to get into and easy to come out of. And everything, because we like to play by the rules, is infection control sanctioned. So it can all be wiped down, right down to the pillows, the ottomans, and as I said, the sofas. And then we have this gorgeous desk. At this desk, families would ultimately be welcomed by our volunteers, registered, and signed in whenever they come in. Our volunteers are really the lifeblood of the space. And at the end of the day, they allow us to remain open 12 hours a day, 7 days a week, 365 days a year. Without them, the space could not remain open. And then through here, we have this lovely fireplace, which on a cold day like today is a welcomed feature. Every so often we do get families interested in keeping their hands busy, so we have a little bit of knitting provided, and our volunteers also provide lovely hats for children, both in the pediatrics and in the NICU. So families, when they come into this space, it's all about taking that much needed break. Earlier I did speak to people forgetting to eat. They also forget to sleep. They also forget to take a break. And that's unfortunate because they're not really at their best for their children. When people are well fed and well rested, they are better for their children. And as I say, we keep them close. It doesn't get any closer than this. And that is your tour. Thank you so much for coming in to visit us. And we look forward to serving Sudbury and the greater region and all the families that hopefully never have to come to hospital. If they do, they're definitely welcomed into this space. Thank you.
All right, thank you for tuning into that live broadcast from Health Sciences North. Head over to Sudbury.com for complete coverage on this and all of your top local news stories. For Sudbury.com, I'm Callum Rodia.